Welcome everyone to our webinar called Telehealth Best Practices for Children with Behavior Challenges, Tips and Tricks to Make Visits More Successful. Thank you for joining us. My name is Cindy Wright, and I'm a program manager for the Child Neurology Foundation, and I'll be moderating the presentation today. Today's talk is part of an ongoing series bringing together caregivers and health professionals to provide expert advice to the child neurology community. Each topic focuses on what we heard from our partners and families as a top priority. We would like to thank our 2021 Education Series partners, Bluebird Bio, Greenwich Biosciences, and Origin. We would also like to thank our behavior program partners, Greenwich Biosciences and USCB, for their commitment to our behavior program. Today, we're discussing telehealth best practices for children with behavior challenges. We heard from families about challenges with making telehealth visits effective, including managing their child's behavior during the visits. Given telehealth continues to be a primary option for many medical visits, we are excited to introduce today's speakers to help provide insight on this important topic. While we are focusing on children with difficult behaviors in advance of making the most of telehealth visits, this topic is relevant for all caregivers. I'm joined today by Dr. Nathan Call and Tangela Gibson. Dr. Carl has been at the Marcus Autism Center since 2006, where he has held many positions as a clinician and as a leader of treatment programs. He currently serves as the center's clinical director. In this role, he oversees all clinical activities and works to develop clinical innovations. Dr. Call has an active research agenda that includes publishing in and serving on the editorial board for several journals, including as an associate editor for behavior analysis, research, and practice. Dr. Call's current research interests include the assessment and treatment of severe behavior disorders. Dr. Gibson is both a child neurologist and a neurodevelopmental disabilities specialist. She founded the Tuberous Sclerosis Complex Center of Excellence at Kennedy Krieger Institute and established an interdisciplinary model of care for children and adults with tuberous sclerosis complex associated neuropsychiatric disorders. She now has moved to La Bonaire Children's Hospital and the Bowling Center for Development Disabilities at the University of Tennessee Health Sciences Center in Memphis, Tennessee, where she has established a clinic and research unit dedicated to tuberous sclerosis complex associated neuropsychiatric disorders. Welcome, and thank you both for joining me today. We'll get started with our program in just a minute. I just wanted to let you know that today's webinar will be recorded, and immediately following the presentation, there will be a brief question and answer session. Please feel free to make questions anytime during the presentation by using the Q&A button on your control bar. Unfortunately, we will not be able to answer all questions, but we will do our best to answer the most asked questions. Also, when asking questions, we respectfully ask that you provide the minimum amount of information you feel necessary to provide your question, for us to respond to your question. Lengthy questions are difficult to understand and respond to. Also, please keep your questions general in nature. Today's presenters will not be able to provide medical advice related to a specific situation. Thank you, and at this time, I'd like to turn things over to Dr. Call.
Thanks, Cindy. Can everybody hear me okay?
Yep.
All right. I really appreciate the opportunity to speak today. I've had what I think is a pretty fruitful relationship with Child Neurology Foundation thus far, and I've really appreciated the chance to speak to different groups that have been organized by Cindy and others to try to help wherever possible. I also want to thank Dr. Gibson. I won the coin toss, and so I got to go first. And so, yeah, hopefully I won't steal too much of her thunder, because I know she's got some really great content, but also some of the stuff that we're going to talk about are kind of common sense tips and tricks that I think oftentimes are arrived at by parents and others. And so it may not differ too much depending on the type of provider you're seeing or the type of situation you're in. So I feel really fortunate to get to go first in this time around. So I really wanted to focus on two different kinds of ways to address these questions around behavioral interventions and telehealth. And so I know that a lot of folks are receiving care for their child or their loved one that are behavioral in nature. So they're working with the BCBA, RBT, and getting behavioral intervention services. And with the global pandemic and all that, a lot of that has had to transition over to telehealth. And so I wanted to talk a little bit about how to get the most out of those types of services now that they're being delivered via telehealth. And some of those services may be focused on addressing challenging behavior in other contexts, and some of it might not. Some of it might be actually focused on other things, developing new skills, working on academics, something like that. And so I wanted to talk a little bit about how those services, when delivered via telehealth, might be a little different, and what could be done to try to get the most out of those. But I also wanted to speak a little bit about how to use the types of behavioral interventions that are oftentimes implemented through those types of services to actually try to make any kind of telehealth encounter as effective as possible. Because again, we're talking about behavior. And so, behavioral interventions, we tend to think about these are specific to teaching, academic skills, teaching self-help skills or whatever, but teaching kids to get through a telehealth appointment is just another behavior. And so these services and these types of interventions can also be used to that end as well. So I kind of try to break my comments down along those two lines of thinking, and I hope it's clear what I'm talking about and why those two are slightly different, but obviously very related as well. So we'll move to the next slide. I think, is that the easiest thing for me to just say that? Okay, great. All right, so I want to talk a little bit about delivery of behavioral intervention services via telehealth. So this is something that has actually gone on for quite a while. And early on in my training, actually, I went to the University of Iowa for my PhD. If anyone on the call is from Iowa, you may have heard it's a little bit rural. It's one of those things where the ability to access expertise is a little bit tough when folks are hundreds of miles from a metropolitan area. And so the state of Iowa invested really early on in setting up telehealth systems. And so I was doing telehealth in 1998, delivering behavioral intervention services via telehealth. So it's something that's been around for quite a while. And so there is this need to be able to fill in gaps when providers are not available in one's local area. And so telehealth was seen as a solution for that in very early days. So as a result of that, there have been quite a few studies showing that behavioral interventions can be delivered through telehealth. And so I'm going to talk just a little bit about some of those studies and one in particular and some of the findings from those as a way to kind of get this conversation started. Next slide. All right, so one of the first things is, as I say, there's really solid evidence that behavioral intervention services can be provided successfully through telehealth, but almost all of those interventions involve some form of training. That is, one of the things that I hear a lot when I talk to families and they say, well, we need behavioral services or we need ABA. And one of my first questions is, okay, that's great. To do what? Because the truth is that you can actually focus on behavioral services can be focused on a variety of different goals and targets, and approaches are going to tend to vary based on what is being focused on. So as an example, for a lot of the most work that's been done on using telehealth has been to focus on challenging behavior. And so that's partly because the process by which one develops these interventions oftentimes already has to be mediated by a caregiver. A typical process for developing a treatment plan for problem behavior by behavioral interventionists typically includes doing some form of functional behavioral assessment. And then from there, developing some strategies to implement and training the caregiver to implement those. That's kind of already part of the package, right? It's baked into the cake, if you will. And so as an example, here at our center at Marcus, we had a clinical service for not the most severe cases, but still pretty challenging behavior, kids with some pretty substantial aggression or self-injury, elopement, pica, these kinds of things. And the program was designed to take place out in the community. We would have our providers drive out to the family's house, and we would be very focused on treating challenging behaviors. And we would ask the family, like, what are your top 3 targets, for example? And the family might say, well, we need to be able to, I don't know, go to the store without getting thrown out of the store because we broke something. Or we need to be able to leave our child with grandma for more than 20 minutes without her calling us to come pick him up. And so that meant if we needed to work on not getting thrown out of the store, you got to go to the store. And if you need to work on being able to leave with grandma, you got to go to grandma's house. And so we had these clinicians who would drive all over metropolitan Atlanta, going to people's homes, going to stores, going to grandma's house, and working on understanding. And there's some real advantages to that, right? One of the advantages is you get to see the behavior in the real situation, right? Working on not getting thrown out of a store in a clinic setting is not really all that great, right? Because it's just not the same as the store. It's not the same environment. Isn't the same context. There aren't the same consequences. And so it's very different from actually being in a store. And so you don't learn the same things about why the behavior is happening, what the purpose of the behavior is on the part of the child, nor do you necessarily learn how to implement an intervention in a setting that has all of the barriers and constraints and hurdles and just peculiarities that come up in those settings. And so we'd had services that involved, like I say, going to the store, going to grandma's house, going to the home for some time, well before we started doing anything via telehealth. And so, but it's also became pretty clear to us pretty quickly that those types of services are pretty well adapted to a telehealth-based approach. Because if you're already going into the house anyway, and you're trying to see what's happening, and half the time you're trying not to be observed or be that weird guy in the corner who seems to be taking data, telehealth is a really good fit for that. You can put a camera up on the shelf and be able to see. And so we had been doing some of that work for some time. And that the evidence for telehealth-based behavioral interventions is really solid for that kind of intervention, for interventions that are focused on caregiver-mediated or caregiver-delivered treatment programming. There is much less, though, on some of the more kind of traditional ABA that people think of when they think of, like, having a BCBA and doing more skill acquisition type of work. And so, when I talk to folks who are kind of, if you know folks who deliver behavior analysis, a lot of what they're doing is skill acquisition work for younger kids or kids with autism, and they're trying to establish new skills in their repertoire through a combination of discrete trial teaching and natural environment teaching and generalization and whatnot. And in those types of interventions, there oftentimes is a lot more direct service to the child, right? It's the therapist, it's the RBT, maybe the BCBA working directly with the child to help establish new skills in their repertoire, generalize those skills to the natural environment. And the caregiver is just less involved. And so there's far less research on that kind of intervention being delivered by telehealth. There's a little bit, it's coming around, but it's just not nearly as far along. So I'll go to the next slide. So just as one example, and this is a study that I was involved in. So Lerman and I and some others, we actually had a study that just ended about a year ago. And this was delivering via telehealth behavioral interventions for problem behavior. There were 18 different providers involved. We were in 4 different states. We worked with 237 different families, conducted over 2,000 different appointments. And overall, what I can tell you is that telehealth works really well for that and can be very, very effective. And I'll talk a little about some of the specifics around how to make it as successful as possible. But again, for that work on challenging behavior, it can be really effective. The main paper that came out on this came out last April, I think, right as COVID was ramping up. And so in some ways, our timing was really good because we'd been doing telehealth for the previous 5 years. And we're just putting out a paper right as COVID was coming online on how to deliver telehealth-based services to individuals and to families. The one limitation is that that paper really was focused on the perspective of the provider. So what can providers do to deal with challenges and barriers that come up in delivery of telehealth-based services to families for behavioral interventions? Things like, what do you do when there's bandwidth problems? What do you do when the child runs out of the room? That kind of thing. And so it's a helpful perspective, but I think that more can be done around thinking about it from the standpoint of the family. So if you're the family and you're trying to get behavioral services for your child, what is it that you can and should be doing to make that as successful as possible? So that's what I want to spend just the next little bit talking about. Next slide. So a couple of considerations that I would really encourage folks to be thinking about when it comes to receiving behavioral interventions through telehealth. The first thing is, does your provider actually have experience using telehealth. The whole world became pretty comfortable with Zoom and WebEx and GoToMeeting and all these other platforms pretty quickly last spring when telehealth became an issue. But that just because one knows how to use the technology and you can schedule an appointment and see into someone's house, it doesn't necessarily mean that you know how to actually conduct an appointment via telehealth. And so I think that it's important to consider if you're looking for an interventionist, if you haven't already got somebody you're comfortable with and they're saying that they are available to see folks via telehealth, really ask that question. Have you done this via telehealth before? What's worked well? Do you have that experience? Because not everybody will, and everybody's trying to keep their business afloat or continue to see families and do good, but doesn't mean that they actually know what they're doing when it comes to actually delivering these kinds of services. Other considerations would be, does your state require behavioral clinicians like BCBAs and RBTs to be licensed? And that's an important thing to think about because different states handle this differently. One of the things that you hear about when you talk about telehealth is there's actually two different sites, obviously, right? And one is called the originating site and one's called the distant site. In this case, the originating site is actually where you are and where the patient's located. And in most states, the provider has to be licensed in the state where the family lives. And so getting services across state lines can be an issue if someone's from another state. If you're located in a state that requires folks to be licensed and someone else is practicing from somewhere else, they may not be licensed in your state. And so they may not be allowed to provide telehealth services in your state. In a lot of professions like psychology and medicine, everybody has to be licensed. Every state has licensure laws. Behavior analysis is just newer. And so some states require licenses like Florida, and then other states like where I'm located, Georgia currently doesn't license BCBAs. And so, someone from Florida could practice in Georgia remotely through telehealth, but the reverse would not be true. And then the other question is making sure that even if they are doing telehealth, do they have the right kind of technology? There's different platforms that have different levels of security. Just starting a Zoom meeting without necessarily understanding, do they have the right version of Zoom? Do they have a business agreement that allows them to do that has security and they can actually ensure that your information is protected? Is something else to keep in mind and check with somebody before starting to receive services through telehealth. So I wanted to talk just a little bit about this was a case example that was shared with me. And so I wanted to talk a little bit about this and then use this as a platform to get into some of the next topic, which is more about actually making these appointments as successful as possible using behavioral intervention strategies themselves. And so really quickly, I'll just read this for those who maybe can't see or if they're looking at it on their phones. So Joe's daughter, Hillary, has been getting ABA services for years at a local clinic, and the therapist has always used a hands-on approach. Hillary is very physical, and Joe is not confident that a behavior clinician can effectively provide behavior management services virtually. So I think in this case, Joe's right on the money to have a little bit of concern, right? Because not everybody is going to be able to deliver these services virtually, partly because they may or may not have that experience. And then also because the specifics of Joe and his child and his family may be an impediment to that being successful. So if we look at the next slide, I've just highlighted a few different things to be thinking about as one thinks of this situation, how it might apply to you. So the first is, it says Joe's daughter has been getting ABA services. So going back to my earlier point, what is the focus of those services exactly? Is it targeting challenging behavior or more skill acquisition? If it's more skill focused, then should they actually be thinking about prompt behavior? Because here it says that she can get pretty physical. It can say he's not sure that they're able to actually do this virtually. And so even if originally the focus was on addressing skill deficits and focusing on things like academics, it may be important to shift gears at least for a little while so that we can focus on prompt behavior so that telehealth visits can go better. And that's something that I've heard a lot. We've seen a lot of families at our center who we were working on skills. We were working on academics and self-help skills or other areas. And then now that we see with the pandemic, kids not having the opportunity to go to school the way that they had previously, or not having the same kind of opportunities for socialization, new challenging behaviors are emerging that weren't an issue before. Kids' sleep schedules are messed up in new ways. The pandemic has really wreaked havoc in all kinds of interesting and challenging ways. And so it's may be the case that the focus needs to shift to address some of these challenges, especially if it's preventing the ability to access services or to get the kind of care that the child needs in other ways. And so making that an area of focus might be the right strategy to take up. Next slide. So this next thing that I kind of highlighted here is this, the therapist has always used a hands-on approach. And so, that gets to something I was talking about earlier, especially when it comes to skill acquisition types of services, especially in ABA. The tendency is to be kind of knee to knee with that kid, right? Sitting at a table with them, presenting tasks, working through skills, trying to establish new skills, direct service to the child. And so even though that is a pretty common approach, there is a lot of literature that shows that even for that type of work, best practices really include caregiver training, even when the focus is on skill acquisition. And part of the reason for that is there's only so many hours in the day. The therapist, even if you're fortunate, one of the lucky few who's able to get dozens and dozens of hours of services through your insurance company, through Medicaid or what have you, even if that's you, that there's still a certain number of waking hours when that child isn't getting those services. And so having caregiver and therapist on the same page, having the caregiver able to implement the same kinds of strategies that maybe are being effective for that child during therapy, even in a non-pandemic scenario, caregiver training should be happening in any good behavior analytic service delivery model. And so I would really think that that's something to emphasize, and hopefully everybody's getting that and it's not an issue. Unfortunately, there have been some studies out of states like Michigan showing, just looking at things like billing and charge data, showing that far fewer behavior analysts are delivering caregiver training regularly as part of their service delivery model. And so that's something to really push for. Again, pandemic or not, virtual or not, caregiver training should be happening. If it's not happening and now we're in more of a virtual scenario, it still can be, it really needs to be the focus. Next slide. And so again, this question of Joe's not confident that a behavior clinician can effectively provide behavior management services virtually. Again, in this scenario, I would agree. It's not the case that it may not be possible to deliver the same kind of behavior management services, but those caregiver mediated services, like I said, can be delivered successfully. There's good literature on that as long as the right kinds of adaptations are put in place. And so I'm going to spend the rest of this, my time before we turn it over to Dr. Gibson, talking a little bit about that. So, when it comes to actually managing disruptive behavior that might be occurring during telehealth visits, I think it's important to remember that some things don't change just because it's telehealth. I've done a couple of talks now for CNF and for other groups. And so some of you may even have heard me speak to this group in the past. And so I apologize if I sound like a broken record. But the truth is, first and foremost, understanding why that behavior is happening from the perspective of the child really is the key, whether we're talking about telehealth or not. We call that the function of the behavior. So what is the function of the disruptive behavior, the behavior that's getting in the way of being able to deliver services via telehealth? When it's just problem behavior that's occurring at home, if it's just a tantrum when it's time to put the shoes on and go outside, understanding, all right, well, why is the disruptive behavior happening when it's time to put the shoes on and go outside? Is it because it's putting on the shoes? Is it because we're going outside? Is it because in order to put the shoes on and go outside, we can't play with the iPad anymore? Like those types of questions, understanding the function of the behavior really are critical in any situation that involves challenge behavior. And that's not less true because it's telehealth and it's behavior that's getting in the way of the ability to deliver services via telehealth. There's been a bunch of research on this and a lot of literature. And really, if you look at kind of the prevalence data, kind of your top three functions for problem behavior tend to be escape from a non-preferred situation. So things like demand, trying to get out of something that you don't like, whether that's a task, whether that's a stimulus in the environment, a noise or a person, but making something that you don't like go away tends to be the most common reason for problem behavior, but only by a small percentage. The other top two are getting access to attention from someone else. So mom's talking to your sibling, mom's talking on the phone, and she's not paying attention to me. And so that can oftentimes evoke problem behavior. And then the third, and one of the this is probably the second most common, would be access to preferred items. So someone took my iPad away. I don't have that one really particular toy that I really love. I'm not being allowed to go outside where I really want to be. So activity or an item, or we're not stopping at McDonald's as we drive past it. And I love McDonald's. Those would be all access to a preferred item or outcome. So those tend to be the top 3 scenarios that can evoke problem behavior just in any situation. But it doesn't really change that much when it comes to telehealth. It's pretty easy to see how a telehealth visit in and of itself can create any one of these types of situations. So if we go to the next slide. If you look at the next slide, so here you see, so using that same example, let's talk about escape. Well, escaping from a non-preferred situation, that can be escaping from a task or a noise or something like that, but it can also mean the child has to now stay in view of the camera or participate in the telehealth visit in some way. That's a demand. The child doesn't necessarily want to be doing that. They want to be somewhere else. And so getting out of that situation can cause some of these problem behaviors to occur. Even staying in the room. One of the things that we saw in our earlier study that I talked about was just even keeping the child in the room sometimes could be a real problem. And that demand can evoke problem behavior on the part of the child. Restricting attention from others, right? Just like I said, the caregiver might be on the phone or talking to a sibling. Well, definitely when they're talking to somebody on a screen, they're not attending to the child. And that can actually evoke problem behavior for some of these kids. And in fact, we see it even more likely when the screen that the caregiver is looking at is also the screen that happens to be the most preferred item. All right, so we see a lot of kids who love iPads, and now suddenly their iPad is taken away so that so the parent can use it to conduct the telehealth visit. So they can use that as a way to see their provider. And so now you kind of doubled up, right? Not only is the parent not paying attention to them, they're also taking away this highly preferred thing so that they can conduct that telehealth visit. So it's really easy to see how a telehealth visit for different kids, different of these might be operative. So for some kids, it's not about the attention, it's just about losing the iPad or some other preferred item. For other kids, it's about having to stay in the room. But understanding which of those is the case is really going to be key to knowing how to handle these challenging behaviors so that the telehealth visits can be as successful as possible. And so again, a good behavioral interventionist should be able to help figure some of that out through a process called functional behavioral assessment. Next slide. So I'm trying to keep my eye on the clock and make sure I don't go over my time. Some things that can be done, again, just to make sure that these visits go as well as possible. The biggest thing is to just try to be prepared. Think these things through as much as possible in advance so that on the day of the visit, especially the first visit, you're prepared and you know what it is that you're going to be dealing with. So if possible, check in with your provider, whether it's a behavioral provider or a medical provider. Sometimes they're not the one who can talk. Maybe it's the person who does their scheduling for them or their practice manager, but just understanding what is the telehealth visit going to involve? Does my child need to be there the whole time? Are we going to be doing any kind of physical exam where you need to actually look them over in some way? Or can they just be off playing in the corner the whole time? Or do they actually need to pay attention? How much of the appointment? If possible, can we shift when that occurs? Does the child, if the child does have to be involved, can it be at the beginning or the end, or does it absolutely have to be the first thing? Because sometimes that can make a difference to the kid if it's, they can be off doing something else and then just bring them over for 5 minutes while they do the little part of it that has to involve them before moving on to the next thing. So these are the kinds of questions, just understanding what to expect on the day of the appointment so that, oh yeah, Timmy's going to have a huge problem with that. How do I go about being prepared for that and making everything as prepared as possible for dealing with that situation? Next slide. Arranging the environment is a big deal. So if possible, if at all possible, I really encourage families to get help, whether it's a spouse or an older child or a neighbor across the street, so that if you're talking to the provider, someone else can be with the child and taking care of their needs and helping make sure that they're not getting riled up or escalating. Also, someone who can, in some cases, block the exits for the child who might otherwise elope. Again, especially with behavioral interventionists, where they might actually be trying to see how the child reacts to different things. If the child reacts negatively, it might be reacting by running out of the room. So in many instances, we've had to rearrange furniture in different ways, or make sure that doors are shut, and make sure that the child's going to stay there so that you're not chasing the child throughout the house. You can kind of keep it contained within a smaller area is always going to be easier than trying to catch them when they're 50 feet away from you on the other side of the house. And then the same thing with preferred items. So like I said, restricting access to an iPad can be a real challenge for some kids, but also other items. So if you can find something that's almost as good as the iPad that can be present, that can make a big difference, or whatever the preferred thing is. If it's a preferred toy or blanket, if it's possible to have that in the room with you so that you can get through that as well as possible. Sometimes this is not necessarily the best time to just try to wait them out or try to restrict things to teach them a lesson. You want to get through the appointment as successfully as possible. And so having things with you that can be preferred, but that you can also keep control of if needed, is a really important step as well. Next slide. And then the last thing I would say is practice. And this is true of everything. You know, when I talk to families about they want to go out to a restaurant, back when that was a thing, way before the Fire Nation attacked and we all went to restaurants. That was the thing that I haven't done in a long time. Or going to the store or whatever. You know, if you're working on your child being successful within a particular context, what we recommend is actually practice doing that. If we would tell families in the olden days, go to the store and actually try it out and see how it goes. But don't go to the store when there's no food in the cupboards and you have to buy, you know, it's going to take you an hour to get through everything. Go to the store when the pantry is stocked and you have the opportunity to just be focused on practicing, and you can leave if you need to, and it's not a big deal. The same thing is true for telehealth. Don't wait until you've got that one appointment with that one sub specialist ND who's the only person in the country who really knows about what it is that your child is dealing with, and they're booked out years in advance, and you finally got your chance to get some FaceTime with that person. And now you're trying to have a telehealth visit and the child's having a tantrum in the corner and you can't hear. Take the time and actually get, you know, grandma or the neighbor across the street or whomever to FaceTime you or Google, you know, whatever, Hangout, that kind of thing, and actually try to have a simulated telehealth visit so that you can actually see what happens and whether or not you're able to make that work. You can see what problems arise and figure out solutions in advance. The same thing is true for your technology, just making sure that it isn't going to be a barrier on your end. Interestingly enough, what we found out, we were having some technology problems and we kept asking people to check their internet speed. Turns out we were the ones with the problem. So there's nothing you can do about that, but at least making sure that it's not your end that's the problem. The technology barriers do happen and they come up a lot. And so just making sure that you have the right app on your iPad, or you're on your phone, if that's what you're using, making sure that you know how to connect it, that you're able to deal with some of those challenges. And then also figuring out how you're going to deal with any problems with bandwidth where you're not able to hear, whatnot. Like one of the first things that we typically will do when we first start an appointment with a family is talk about, here's what we're going to do if we get disconnected, right? So we're not doing that whole thing where I'm calling you, no, you're calling me, and we can't figure it all out. That should be the first thing that gets covered so that when those things inevitably happen, we're prepared and we have a plan. Next slide. So again, just to hit those high points really quickly, you want to try to actively manage problem behavior, anticipate problems, think about the function of the behavior so that you can really build that into your thinking about how to address that. Be prepared, and if possible at all, practice in advance so that you're ready on the day of. I know I've gone a little bit over my time, and I apologize to Dr. Gibson for cutting into her time a little bit, but I'll step back now and let her take the wheel.
Okie dokie. Thanks, Nate. Thanks, Cindy, for having me. Thanks to those of you who made time today. I appreciate you being here. So I'm going to talk a little bit about neurodevelopmental telehealth visits. Next slide. So first, I want to just tell you a little bit about the role of a child neurologist and neurodevelopmental disability specialist. So I'm a medical physician, and what I do is I'm like a subspecialist of neurology, and my entire focus is children and adults with varying types of special needs. And so we see them in clinic, and typical clinic visit, I'll tell families usually there are three major questions that people want to know. One is what's going on. In that case, we're working on diagnosis. Sometimes they want to know why is it going on. In that case, we may be thinking about blood work, genetics, but overarching, most people want to know what to do about it. And so that's one of the major areas that we focus on. I'm so glad that Nate was here to present a perspective from a behavioral therapist point of view, because that's one of the common things that we recommend when kids are having disruptive behavior. Great, next slide. So we talked a little about the content and focus of a visit already. And then the feedback to date. So when we made this shift, and for us, we didn't have the privilege of doing telehealth for a long time. It was always something that we thought would be a great idea, specifically for the patients I serve who have tuberous sclerosis, who are, around the globe, and some of them have trouble traveling. I've always wanted to do telehealth with them, but we were kind of forced into it. And so the feedback to date has been mixed. My thought was, wow, this is going to be great. It's going to be great for everybody. And for some people, it really is great. Some people are enjoying the privilege of not having to travel, especially if the kids are having some struggles with traveling, or if it's not, if they're not able to travel. then other folks are having some trouble, like they prefer in-person visits. And so that's been hard for some people. Next slide. All right, so I want to hop right into some cases, and I'll read it just for folks who may not be able to pull it up. So we have Anne and Tom. Anne is not confident a doctor can effectively evaluate Tom while remote. She doesn't believe a doctor can give a thorough evaluation without physically examining her child. She also doesn't feel comfortable talking about Tom's symptoms and challenges with Tom in the room, but he won't leave. She used to have a private discussion with the doctor while Tom would go with her husband to the waiting room or car, but when at home, they don't have privacy. Next slide. So here are some thoughts. One, if we can have as many records in advance, and sometimes if families say, you know what, I really need to talk to you privately before this visit, those can help. So we can figure out what those concerns might be without intruding on or causing a problem with Tom. But then a second thing would be considering letting Tom lead his own evaluation. If he has concerns about what she's saying, maybe there's something that he wants to express. And oftentimes that can be very beneficial, especially for teenagers to get ownership in their own health and to express how they're feeling. And then oftentimes they'll feel differently about letting their parent chime in. So if I were interviewing Anne and Tom was having a big problem with his mom saying things, I'd say, hey, Tom, why don't you just tell me what's going on? What your questions are, what your concerns are. And as he's going along, if there's some areas where he's struggling, I say, well, Tom, would it be okay if your mom helps you with that question? And then he can see her as a partner and not one who's attacking him. And also making sure to explain to him that we're all here just to help him. We're not here to pick on him. We're not here to tell him, he's not a bad kid or anything like that. We're just all here to try to help. And in that regard, we can support the parent-child relationship because at the end of the day, after the visit is over, they're with each other 24/7, especially now during COVID. People are with each other a lot more than they expected to be. And for some families, that's great. And for some families, that's a challenge. So we try to figure out how we can support that relationship. For some families, it might be family therapy, but trying to build that so that he can feel confident that, sure, my mom can represent me well during a visit. I'm not concerned about what she's saying. Next slide. All right, let's talk about Mary and Joe. So Mary has difficulty focusing on the questions asked and information provided by the doctor because she is distracted by Joe's behavior in the background. Joe refuses to sit still and tries to hit Mary or take away the iPad they're using for the appointment so she can play a game. The family only has one device, so Mary doesn't know how to keep Joe quiet. Right, next slide. So a couple of things. Number one, there's always room for a break. In a lot of our telehealth visits to date, children can have meltdowns, things can happen. I think it's funny now, in retrospect. At the time, the parents were a little bit embarrassed, but we were having a telehealth visit. And I said to them, I said, he might be getting cold back there. And they said, what? I said, yeah, he doesn't have on any clothes now. And so he had taken off all of his clothes and was kind of jumping across the bed. And at the time, the parents were mortified, but we all kind of had a good laugh about it. And I said, okay, just give him a break. Please get some briefs on. And we continue to move on with the visit. Again, in this case, Joe's a little guy, but some of the little guys enjoy kind of being in the camera. They like hearing their name called. So if I can call them over or show them something, that might help. And then guiding Mary's interactions with Joe. Oftentimes, this can be a good teachable moment. I remember one visit we had, mom was there. She had 3 children there. They were screaming and doing different things. Dad was in another room. And I said to her, will the children be safe to be in a different room? She said, oh yeah, Dad's in the other room. So I said, well, why don't you, let them go hang out with Dad? But she wasn't accustomed to doing that. So we were able to guide her to let them, go and hang out with Dad. They were going to be safe. And she said, well, I didn't want to bother him. And I said, well, sometimes it's okay to ask for help. And Dad's right there. He wants to help you. It's okay to tag him in. Focusing on the visit essentials. There's a lot of things on the medical side that could be taken care of by phone or later or by parent portal, but what are the essentials for that visit? And then choosing the optimal timing for future visits. If Joe has a nap time, I always tell families, tell us exactly what you need and we'll do our best to accommodate. So if he has a nap time and you prefer to do the visit at that time, then that's fine too. Next slide. I almost said next visit. So meet Sam and Susie. Susie controls her disruptive behaviors better when in the office and has fewer distractions, but when at home, she won't sit still and wants to leave the room to play with her toys. She throws a temper tantrum and tries to run away while Sam attempts to hold her still. Sam is embarrassed that she cannot control her daughter during the appointment and fears the doctor will think she's a bad parent. Next visit. Okay. So a couple of things. One is for little kids, allowing a little bit of mobility. That's to me one of the kind of the upside of telehealth is that kids don't necessarily, at least for our visits, don't necessarily have to be as still as they would be in a clinic setting where we don't want them to get hurt. I've observed kids jumping on trampolines, on swings. Kids have shown me their basketball moves, their football moves. So allowing some mobility is okay. And kind of considering that upside, that they can have some freedom, that they can be in their comfort zone is good as well. And last but not least, in this case, one thing that I noted, and this happens to a lot of parents, is feeling embarrassed. It is perfectly okay to drop that mask. We're trying to find the bright side, but this is not an easy situation. It is a pandemic. None of us have ever been in a pandemic before. None of us have ever been this close to our relatives before and staying inside all the time. So it's okay to just be human. Next slide. So let's summarize. So preparing, sending records and any special considerations, like some families will say, don't mention XYZ. If there's some unmentionables that I shouldn't say in front of a child, then that's important to know ahead of time. Next. Testing the reception. I think Nate touched on that too. Just kind of seeing, like, I know in my house, I need to sit in this spot. If I move over to that spot, you guys won't hear me. So figuring out where the best reception is in your house. Next one. Scheduling at the optimal time, like we talked about, just figuring out what's that best time for you. And then getting visit specifics. So I would say, especially if you're doing a telehealth with somebody for the first time, figuring out, okay, how long are these visits exactly? How much time do you need with the child? What do you need from me? So figuring out all of those things that you need. Okay. And then here, I don't know if there was something on the top one that I deleted. So maybe it's, there we go. Oh, looks like the same thing. Yeah, we're focusing on the essentials, being open to guidance from the professional that's doing the telehealth visit, and forget perfection, just throw it out the window. Don't worry about it. We're all just doing the best we can. And then sitting in a well-lit area. Okay, and then follow up. This is essential. Anything that you felt you didn't get a chance to discuss, making a list right after the visit. If there's records that need to be sent, or if there's videos, like he always does this thing, he just didn't do this thing this time. Feeling free to send that after the visit, deciding on the structure for the next visit, and then providing brutally honest feedback for the physician or the therapist that you had the telehealth visit with. I've been inviting that from my families, and we've been acting on that in order to enhance the quality of our visits. And fortunately for families, we do have an in-person option as well. But getting that has been vital for us in deciding how to best serve families. Okay. And one thing before we start with questions that I want to add, and I always like to add this, I'm sure there are some family members on the line. I'm sure that there are some of you with behaviors, and I'm glad we were able to give some tips and tricks. But I want you to know, don't give up hope. I know that we aren't able to get to everybody's questions, but no matter what the situation, no matter how bad the behavior might seem, things can get better. So, happy to take questions.
Thank you, Dr. Carl and Dr. Gibson. This is a wonderful presentation, and I know I have some new things to try at my next telehealth appointment tomorrow. And so I encourage people to start submitting questions. One question is, you mentioned sending information to the doctors in advance and preparing as much in advance. What do you do when you don't feel like the doctor is reading any communication prior to the visit? So you send it, but what if they're not doing their part?
You know, that can happen. I know, a lot of people are busy, and sometimes they may not read it in advance. I would, if that's like a recurring thing, I would go ahead and ask them, what information do you need from me? And try to provide that, maybe if they feel overwhelmed by it. I know I love the binders when they come in. I just had a 2-binder visit today, and I go through every page and try to, and find the things that I need. But I would kind of start there, and I would say, don't let that discourage you from keeping records, because it is very, very helpful.
Great. Do you have any thoughts, Dr. Call?
No, I think that's right on the money. I think, you hope that kind of stuff is going to be helpful, but I also try to empathize, having been on the other side of it, where, you're like Dr. Gibson was saying, those 2-binder appointments where there's a lot of information to digest, and you're trying to help as many families as you can. And there's only so many hours in the day. And so it's definitely happened to me, even where I haven't had as much time to really fully digest the information that I have going into an appointment. But to her point, if it's happening more than just once or twice, then it may be that you need to think about how to best get the information that they actually need in a way that's most digestible for them. And asking that question very concretely might facilitate that.
Next question. My daughter is 14 and is not a good historian and will often not even try to respond to questions. How do I get her to respond?
I don't want to keep jumping in if you ever want to go first, Nate.
No, you go for it.
So the reluctant teenagers, couple of ways that I've found to be helpful. One is I encourage my teens to kind of do medical journaling. So they sit through the visit, they're absorbing a lot, but they may not want to talk to a physician or a therapist. So I try to encourage them to journal, and try to, maybe as a parent, having private conversations with her to figure out if there's something about that visit that's really making her uncomfortable. And then giving that feedback to the physician or the therapist. They may have a white coat issue or something that the physician or therapist that could do better, or maybe it's a space issue, like don't be so close, don't be so loud. So I would say get some more feedback from her, encourage her to write her thoughts or draw her thoughts, and then just keep working on it, because over time those relationships can build.
All right. Next question. If a doctor or other laws around having an appointment with a doctor when the children is not present. So for the parent coaching, are those covered by insurance, and how does that work?
Sorry, can you restate that? I had a hard time hearing for a second there.
Oh, so the question is, are there laws about having patient or parent only visits without the child being present? And does insurance cover the parent coaching sessions you discussed?
Yeah, so there are different, so right now, there have been some exceptions made by most payers. So insurance companies and Medicaid have kind of come out and said that due to the pandemic, some of the regulations that were really restricting the ability to deliver some care to see kids and families through telehealth have been lifted. but only to a certain extent, right? And so you tend to still use, if you ever really want something to help you sleep at night, I suggest reading some of the billing and coding regulations for how healthcare gets paid for. And so some of the codes that are used for parent training and behavioral interventions do require that the child be present, and others do not. And so it really just depends on what type of provider you're seeing. So psychologists, for example, use different codes than BCBAs, who use different codes than MDs. So it really is going to tend to vary. And even different insurance companies pay different codes and some not others. So in short, it's a pretty convoluted mess. And it really means you need to talk to somebody in advance and really try to get an understanding about that, so you don't get hit by a big bill down the road, which is something that can happen too.
All right. Next question. What are some things parents should consider if they really just feel like telehealth is not working? Are there exceptions made? Can they insist on being seen in the office?
So I can answer for our program. So, Cindy and I were actually talking before the webinar started today that we continue to see some families in person, but it is really an exception, and it is really only those families that are those kids who are engaging in really severe forms of problem behavior that are in some ways that are threatening pretty significant harm to themselves, to their loved ones, or in some cases might be threatening out of home placement, right? That if it were not for intervention, that they would have to be placed out of home. And even our setting, we've taken pretty extreme measures with personal protective equipment. All of our staff are now vaccinated. We have a lot of things in place in terms of keeping kind of people in a bubble. So it's a one team and you're only working with the same therapist every day and all that. And I don't think that very many providers are set up with that level of staffing, that level of kind of specialized space to be able to see kids successfully. Now, if you happen to live in a handful of places that can do that, Dr. Gibson, I know, was at the Kennedy Krieger Institute. They have the ability to do some of that. And there are other programs around the country that do, but they're the exception, not the rule. And I think for the most part, providers are tending to steer clear of seeing kids in person just because of the harm that can come from exposure to COVID. And so the thing to do would be to kind of look at your area, see what programs are around. A lot of the ones that are seeing kids are part of big hospital systems or university systems. So you may be already pretty familiar with some of those if you're in one of the areas that has a program like that. But unfortunately, the bad news is that most providers just are not equipped to see patients in person safely.
And I can speak on the medicine side. So I'm not at Kennedy Krieger anymore, Nate. Right. I'm in Memphis, Tennessee now. But so on the medicine side, most colleagues I've talked to have an in-person option. Because if you let us know, like, look, no, there's something medically going on that I need you guys to see. At least for our hospital and colleagues I've talked to at other institutions, we're not able to refuse an in-person visit, is the way it's been explained to me on the medicine side anyway.
Great. I'll do a call for questions. I have one more right now, which is, if I feel like my doctor or behaviorist is not very good at doing telehealth, what's the best way to tell them, give them that feedback, and is there a place where I can send them to learn how to do it better?
You mean like send the doctor to telehealth school?
I love that question.
I think be honest, most of us have a tough skin. If we don't, we have to get a tough skin, and it's fair to just say, this isn't working for us, and whatever it is that's specifically not working. Either I can't see you, I can't hear you, it's not the same as before. Is there anything you can do? But I don't think the health school forum, you just have to kind of, we're all kind of learning, just give them some feedback.
Yeah, I like the thick skin comment. I think that's right on the money. If you do this for very long, not everybody, nobody clicks with everybody. And so everybody, if you've done this for very long at all, you've come in contact with someone you didn't click with and you've gotten some feedback, right? And that's just part of the process, and it's to be expected. And so especially if it's candid and respectful, that's the kind of feedback that I think tends to resonate with people. It's, you're not coming across as angry or mad. You're just giving, if it's someone that comes across as angry or mad, it's easy. It's almost in some ways easier to be dismissive of that. Well, this person and I just don't click, right? But if you're saying like, look, I think you're a great clinician, but this is not working for us, and you're presenting it in that candid and respectful way, I think that resonates with people the most. With the behavioral folks, I can say, I mentioned that there is a literature on this, and it's been out for a while. And so there are papers like the one that I brought up by Lerman that came out last year that actually talks about, here's how you can handle some of these challenges that arise. And so maybe a real not so subtle way is to maybe email them that article and say, you know what, you might benefit from this because, I'm noticing we're having some of these same issues. Maybe take a gander and see if this might help you out a little bit. It's a little subtle and underhanded, but that might be one way to try to convey that things aren't going as well as you expect.
And they just might thank you.
Yeah.
Just might thank you. I've gotten some feedback that wasn't always friendly, but I was thankful. I learned something from it. I changed, some things. So, yeah.
Right. Awesome. Well, we don't have any more questions. So on behalf of the Child Neurology Foundation and our partners, I want to thank each of you for your participation in today's event. We hope you found the information presented helpful. I know I did. And we'll be posting a recording of this event online, and we will send an email link to everyone who joined us and registered with a link to that event. The event will also, or the email will also include a link to register for our next webinar, which is Age-Appropriate Behavior Management, Strategies to Address Difficult Behaviors in Children with Neurologic Conditions. And that will be on February 10th. So with that, I will close today. Thank you all again. And please take a moment to complete the survey that will pop up when this webinar ends to help us improve our future webinars and make sure we're meeting your needs. Thank you.
Thanks, guys. Take care.
Thank you all.
Thank you. Bye.
Bye.